Hello everyone. In this video we are going to talk about neurosis. It is a less severe form of psychiatric disorder where patients show either excessive or prolonged emotional reaction to any given stress. Classification: anxiety disorder, phobia, OCD, dissociative disorder, somatoform disorder, post-traumatic stress disorder and hysteria. Dissociative disorder is further classified into dissociative amnesia, dissociative fugue, dissociative identity disorder. Anxiety disorder. Definition: it is an unpleasant state that involves combination of complex emotions such as stress, worry, accompanied by physical discomfort such as chest pain, shortness of breath. Anxiety is defined as the disorder in which an individual suffers from recurrent unwanted thoughts or uncontrolled fear or nervousness. Etiology: genetic factors such as monozygotic twins, psychological factors such as stress, unresolved conflicts, traumatic experience, behavioral factors such as positive and negative attitude, medication or substance abuse. Sign and symptoms: excessive worry, insomnia, headache, decreased motivation, restlessness or fatigue, increased heart rate, hyperhidrosis, social withdrawal. Diagnostic evaluation: history taking, physical examination, mental status examination. Treatment: anti-anxiety and antidepressant drugs. Therapies: behavioral therapy, cognitive therapy, group therapy. Phobic disorder. Definition of phobia: it involves persistent and excessive form of fear of an object or situation. Types of phobia: first one is specific phobia. Claustrophobia is the fear of confined space. Aerophobia is fear of flying. Hemophobia is fear of blood. Gamophobia is fear of marriage. Acrophobia is fear of height. Hydrophobia is fear of water. Second one is social phobia and third one is agoraphobia. Agoraphobia is the fear of being in public places. Etiology: brain chemistry, arises from combination of external and internal events, traumatic or past experience. Genetic. Sign and symptoms: immediate anxiety when contact with the fear object, sweating, increased heart rate, confusion, urinary urgency. Diagnostic evaluation: history taking, physical examination, mental status examination, biochemical test. Treatment: in that pharmacological treatment, social phobia and agoraphobia is there, then only medication is given. Anti-anxiety and antidepressant drugs are given. Therapies: exposure therapy, systemic desensitization, in that virtual reality therapy, behavioral therapy, cognitive therapy and group therapy. Obsessive compulsive disorder, OCD. Definition: OCD is defined as excessive thought that leads to repetitive behavior. For example, fear of germs and need to arrange objects in specific manner. Types of OCD: checking OCD, contaminating OCD, hoarding OCD, rumination OCD. Etiology: genetic, in that monozygotic twins, abnormality in neurotransmitters such as serotonin, dopamine. Childhood trauma, sociocultural factors, post-traumatic stress disorder, broken family, child abuse, sexually abuse. Clinical features: obsessive thoughts, obsessive images, obsessive doubts, decreased confidence level, social withdrawal, fear of causing harm, confusion. Diagnosis: history taking, patient examination, mental status examination. Treatment: pharmacological treatment, anti-anxiety, anticonvulsion, mood stabilizer, antidepressant. Therapeutic treatment: exposure therapy, behavioral therapy, group therapy, electroconvulsion therapy. Dissociative disorder. Definition: it is a mental disorder that involves experiencing a disconnection between thoughts, memories, surroundings, action, and identity. Types: dissociative amnesia, there is a sudden inability to recall important personal information. Dissociative fugue, it is a sudden unexpected travel away from home or workplace. Dissociative identity disorder, also known as multiple personality disorder. Causes: chronic childhood trauma, physical or sexual abuse, family environment. Signs and symptoms: depression, anxiety, problems with handling emotions, feeling that world is not real. Complication: severe depression, anxiety disorder, insomnia, thinking of suicide, breaking of relationships and losing job. Diagnosis: personal history, patient examination, mental status examination. Treatment: In that pharmacological treatment, anti-anxiety, antidepressant therapies, clinical hypnosis, talk therapy, eye movement desensitization and reprocessing, cognitive behavioral therapy. Somatoform disorder or Briquet syndrome. Definition: somatoform symptom disorder is any mental disorder that manifests as physical symptoms that suggest illness or injury but cannot be explained fully by the general medical conditions. Types: hypochondriasis, obsession with the idea of having a serious but undiagnosed medical condition. Somatization disorder, it is characterized by chronic multiple somatic symptoms in the absence of any physical disorder. Conversion disorder, a somatic symptom disorder involving the actual loss of bodily functions such as blindness, paralysis, numbness due to excessive anxiety. Persistent somatoform pain disorder. The main feature of this disorder is severe pain without any physical basis. Causes: idiopathic, biological, antisocial personality disorder. 29% in monozygotic, 20% in dizygotic. Organic brain disorder. Diagnosis: personal history, patient examination, mental status examination, test to rate out underlying organic disorder. Treatment: antidepressant therapies, group therapy, individual therapy. Post-traumatic stress disorder. Definition: it is defined as the condition which is marked by the development of the symptoms after exposure to the traumatic life experience. Symptoms like fever, helplessness, avoidance. Types: acute post-traumatic stress disorder and chronic post-traumatic stress disorder. Risk factors: women are at greater risk than male. Previous traumatic experience, family history of PTSD or depression, history of abuse, history of depression, anxiety, lack of support after trauma. Signs and symptoms: intrusive, upsetting memories of event, flashback, nightmare, depression and anxiety, suicidal thought, insomnia, social withdrawal, outburst of anger. Diagnosis: personal history, patient examination, mental status examination, signs and symptoms. Treatment: pharmacological treatment, anti-anxiety, antidepressant and mood stabilizer. Therapies: exposure therapy, cognitive therapy, behavioral therapy. Hysteria. Definition: conversion disorder, formerly called hysteria, a type of mental disorder in which wide variety of sensory, motor or psychic disturbance may occur. It is not caused by organic disease of the brain. Signs and symptoms of hysteria: blindness, emotional outburst, hallucination, overdramatic or excitable behavior, loss of sensation, paralysis in arm and leg, vision problem and balance issue. Hysteria is of two types. Primary: due to substantial personality disorder, it is difficult to treat. Secondary: due to anxiety depression, treated by treating the primary cause. Anxiolytics and antidepressant may help these patients. Both sensory and motor controls are affected and body may react with paralysis or a limb tremors or some other similar physical condition in response to stress or trauma. Causes: extreme trauma, extreme stress or depression. Diagnosis: personal history, patient examination, mental status examination, tests such as imagining scan and electroencephalogram. Treatment: relieve stress and learn to deal with trauma. This can be done through therapy to understand your condition and deal with it better. Maintaining a positive work and balanced life, eating healthy and maintaining positive relationship, creating a comfortable atmosphere for yourself.